They are all educated people. They know that alcohol is wrong.
Yes. What happens is the fun you get by doing wrong things is more.
Many bariatric surgeons, when they do the surgery, they see the actual cirrhotic liver
Yes,
sometimes.
yes.
But on the imaging, the ultrasound or the CAT scan will show a relatively normal liver.
Correct.
When we talk about this to the patients, they always are scared of surgery.
Correct.
Can you educate the audience what is bariatric surgery?
We put a small holes on the tummy. Small holes, like a camera, we put a camera, laparoscopic technique basically. We go and reduce the size of the stomach.
People say they eat 3 meals a day. And people are saying you should eat only when they are hungry.
Yes.
Even among the medical literature, there is a split in the opinion. What do you think? Oxygen is not going inside the lungs at all.
Yes, a machine called BiPAP, where the machine pushes the air into forcibly inside.
One most inspiring transformation that keeps you going.
And she has not menstruated from 2 years. Somehow she got married. She didn't conceive.
So a person listening to this podcast, okay, so they are very confused. Okay, so I am saying fasting, you are saying surgery, and somebody is saying that Mount Jaro, Ozempic.
With the surgery, you may lose 80% of your excess weight. In medicine, you may lose only 10% of your excess weight.
Today on the podcast, I'm joined by Dr. Moinudeen, a leading bariatric and metabolic surgeon based in Bangalore, India. He works at the intersection of surgery, obesity medicine, and long-term lifestyle care. Dr. Moinudeen has helped thousands of patients achieve durable weight loss, diabetes remission, and improved quality of life through surgical options as well. In this conversation, we cut through myths around bariatric surgery, discuss who truly benefits, and explore how surgery fits into a lifelong health plan in few patients. This episode is practical, science-driven, and focused on real outcomes. Let's dive deep into it. Hi, Dr. Moinudeen. Thank
Hi,
you.
Dr. Pal.
Thank you for being there. I'm going to start right off the bat with this question. Why is losing weight hard today?
See, what happens is weight is a problem everyone is suffering all over the world. And especially in India, what happens, we are all rice-eating population. We have a lot of tummies and all. At least if they are not obese all over the body diffusely, but at least they have central obesity. So this weight is very difficult to lose because weight is something related to multifactorial. It is not one factor which is causing this. One is genetics. Parents are obese. Now the kids have become obese. The other is hormonal changes in women, PCOD, hypothyroidism, which is making them gain weight. The other thing is insulin resistance, which is making them gain weight because insulin is a pro-lipogenic hormone which accumulates the fat. There is a lot of screen time, which will allow the mobility less. And number of 4 is the lifestyle modifications, like a lot of lifestyle factors, like a lot of sitting job and all this stuff, less mobility, and easy availability of food, like delivery apps. With a click of the moment, you get food within 5 minutes. Before, you used to go cook and all is to happen. Now it is very easy to get the food, and everyone is affordable to have everything. So if you see the advertisement, a lot of advertisements depends on the carbs. So a lot of carbs are consuming because of the advertisements which we see. There's so many factors. So it is not easy to lose weight. And nowadays what happens, because of so many factors, they're putting a lot of weight because the BMR is going low and low. So which is making them gain weight.
Can you educate the audience what is BMR?
Yeah. BMR is basal metabolic rate. So for example, if you take some calories into your body, you need to burn it. Understand, right? So if you're burning less, for example, an average, for example, for me, the BMR should be around 2,500 calories to 3,000 calories. If my BMR is around 2,000, it means I'm putting on 500 calories every time I'm consuming. So in this way, the calorie consumption, it will make you gain weight because you're putting on the positive calories inside. It is not burning. So it's accumulating in the body as fat.
And what is the normal BMR for a normal patient?
No, actually, it depends on your height, weight, and all the body mass index. And so many other factors are there. We can't say exactly this much. But on average, if you really see, what we see is around, for example, patient who is 180 kg, they should have around 2,800 to 3,000 calories minimum BMR. The thin built patient should have a BMR of around 2,000. So if the patient is 40 years, they should have some specific BMR. So BMR varies from person to person. So the burning capacity slows over age. As you age 40 plus, you keep putting on weight. So that's because you have tummy. A lot of Indians, you see, a lot of tummy is there, central obesity, because the reason is after 40, the basal metabolic rate comes down. The burning capacity comes down, so they put on a lot of weight in the tummy.
I'm just trying to simplify this.
Yeah.
So let's say a patient's basal metabolic rate is 1500.
Correct.
And 1500 is the calorie that is needed for normal maintenance of your activities,
Correct.
like walking, talking.
Yeah.
If you want to lose weight, you have to go a little bit less.
Correct.
So sometimes people are saying that, my basal metabolic rate is very low to start with. Should they go on even less calorie? For example, let's say BMR is 1200. Should they go on like 800 calorie diet?
See, actually, what happens is, to be very frank, there is a formula which helps in calculating how much calorie consumption is required. BMR into total expenditure. We get a value that is called how much calories we have to consume. If the calorie consumption is more, then we are taking more calories. It means we have to consume less. So what happens is, but not everyone who takes less calories, they lose weight. The reason here is there are so many factors which is not allowing you to lose weight. So all the factors should work in your favor for the BMR to work.
How do one calculate BMR?
So BMR, there's a big formula. I think you can get in the internet. So what happens is BMR varies from age to age. It varies from genetics. It varies from the geographical location where you are. It depends on the age. It depends on male, female. It depends on hormonal. So many factors which will influence the BMR. So everyone's BMR should be different. I think what we do is, whoever patient comes to an OPD, we make them stand on the BMI index machine. Those machine will give a relative BMR, basal metabolic rate. So what happens is, what I see in many of the patients is, all these obese patients who come 150, 180, who walks into my OPD, the BMR is less.
So 150 kilo patient, the BMR is actually less.
Yes, obviously. That's the reason they're gaining weight.
So just to simplify that, so that patient BMR was less, let's say like 1500, but they have been consuming 2000.
Yes.
And they're not burning that much.
Yes.
And those 500 calories kept on
Positive,
accumulating.
it's going to gain weight. That's how it is.
And what is the name of the machine that you
The body mass index. It's manufactured by many machines. But what I use a Korean machine that is called InBody Mac. Many of the gold gyms, they have a lot of these machines. So this machine is around a little expensive, but 5 lakhs to 6 lakhs at machine cost. But what happens is, this gives an accurate measurement, how much body fat you have, how much body muscle you have, minerals, water weight, how much water, and how much fat excess. What is your activity score? That also it calculates. So many things are there.
If someone needs to check their BMR and want to check this in-body scan,
Correct.
They can go to any high-quality
gym and get the BMR. See, what happens even for the people who opt for the surgery, the insurance people want a printed report for BMR, not the calculated one. We calculate height and weight and all, BMI. They don't want that. They want a proper printed report.
Why is it?
People think they think we can write whatever you want, right? So they want a proper printed, so it will be genuine kind of thing. For the insurance purposes.
But insurance covers these surgeries.
Yes. Nowadays it's getting covered because a lot of insurance companies have accepted obesity as a disease. And they accepted obesity will cause metabolic issues. So whenever they have obesity with metabolic issues like uncontrolled diabetes, blood pressure, diabetes related cardiomyopathy, you have obstructive sleep apnea, diabetes related. So metabolic issues with obesity, they considered it as an issue, major burden for the society. So they consider this into the obesity category. So now they think that they can give insurance for these things. They're giving insurance approvals.
If a person has diabetes, will the insurance cover or deny that as a pre-existing condition?
No. See, diabetes, if it is before the policy, they will consider as pre-existing. Once they take the policy, afterwards it comes, they definitely get covered. And you have to have a waiting period. Whenever you take insurance, it will not get covered immediately. It takes 2 to 3 years to get covered for the specific disease.
But if it covers most of the expenses.
Yes, most of it. So it depends on how much policy terms and conditions. But corporate insurance, the chance of approval is more high than the individual insurances. What I see most frequently, because a lot of people in Bangalore, because I operate in Bangalore, so a lot of people are software techies, and somehow their relatives are in software, parents are in software, children is in software. So some insurance, they have corporate tie-ups.
Okay.
The chance of coverage is high for them.
The reason I'm asking about all this is there
Yeah.
was a doctor who came on the podcast and then said that insurance companies, especially the government ones,
Yeah,
they have some unrealistic expectations.
correct.
So the whole bariatric surgery should be covered only within like 50,000 rupees or 20,000 rupees, and you have to do only
So
within
that is the government scheme.
Ah,
This is not government scheme. This is an insurance,
private insurance.
private insurance.
Okay, so look, go for private insurance. Okay. As a metabolic surgeon, right?
Yeah.
So you are a metabolic disease surgeon. Why do some people eat a lot and they don't put on weight?
Yeah.
And some people just look at the food and then they gain weight.
Yeah. So some people will have everything working for them. For example, the body working for them. So whatever you are eating, you are burning it. The basal metabolic rate is good for them. The BMR is good for them. People who have low BMR, they put on. High BMR, even though they are eating, they're burning. Whatever you're eating, it's burning. So that's a good thing about them.
Is BMR genetic?
Yeah, BMR actually 40% is related to genetics. For example, if your parents have low BMR, there's a high chance that even your kids may acquire that. So 40% is genetic, I can say, roughly around.
How do we increase our basal metabolic rate?
So better metabolic rate has to be like every step which you take, you have to increase the small initiative. For example, you take more often stairs instead of lift. You park your car far from destination, and the food you eat, try to eat less rice, less sugars, curb the complete carbs should be come down, and try to eat a habit of taking high proteins, and try to make an habit fitness as a part of your routine. In India, it has not been like this. In India, fitness is people who are affordable, they go to gym like this. So
Or
bodybuilding, and someone does bodybuilding, they just criticize, oh, you are bodybuilder.
Correct.
So this is not, it should be like everyone's habit. Because if you are not healthy, whatever property you earn, you will not enjoy it. So they invest on high expensive cars, expensive phones and all, but they think this physical activity should be good to enjoy those things, because you should live long to enjoy those things. They don't think about that. So for them, walking and all this activity, they think it's only for luxury people and all these things. So it should be part of your life. That's what I feel. It should be incorporated in a part of your life.
This is a very debatable question. Just
Yeah,
wanted
please.
to ask you.
Yeah.
In US, obesity is very common in lower socioeconomic status.
Correct.
And now it has become universal pretty much in all kinds of economy. How about in India?
It's reverse. Higher economic status is common because what happens, for everyone you have someone to help here. You have 10 maids, 2 secretaries. So instead of you doing work, they do it. You order them, they do it. So what happens, the physical activities become less there, and you don't put an effort to do those things. For example, I have to pay an electricity bill. I just say, go and pay. They pay the electricity bill. You need not go because you're affordable. And wherever you go, you don't walk. You just take elevator, whatever it is. So what happens? And you're so rich, so you can afford any kind of food. So obviously, which is tasty is the high calorie. High calorie is very tasty. So you take more.
So do you agree with that?
And you party more. Therefore, so you take a lot of alcohol, calories, and all this stuff. So
Alcohol is bad, but alcohol can cause weight gain.
yes, a lot, because alcohol has very high calorie, and in the liver, what happens? Whatever ethyl alcohol, whatever we take, it goes and accumulates as fat. Because we feel like a lot of people who are alcoholics and who consume beer, they have thick cheeks, and you see that puffiness happens, and slowly they put on a lot of weight because the high calorie consumption like alcohols will directly accumulate the fat. That's what I always feel, because people, apart from the fatty liver they have, forget about the functionality of the liver. Even putting on weight is very common. You see central obesity very common.
Central adiposity is the belly fat.
Belly fat. It's very common in those patients.
In your patient, how many person who's obese, like 150 kilos, how many percentage or drink alcohol?
So to be very frank, it is around 30 to 40%.
40%.
It's increased, especially the males, and females are also no exception. Females
Is it
no
right?
exception. Yeah.
Are you
Nowadays,
serious? Women who are having high body mass index, the
yes,
reason could be because of alcohol.
good amount of alcohol they consume. And see what happens before party was something else. We go out, eat, and come back. Here, party nowadays is all alcohol. The alcohol without party is not matching actually. Party means that. The definition has changed. So alcohol is mandatory kind of thing situation. So everyone consumes, like especially in the weekends and all. And Bangalore is a techie city, so it starts from Friday night itself. So we have 3 nights.
But I'm going to argue from their standpoint. They are all educated people. They know that alcohol is wrong.
Yes. What happens is, so everyone knows many things, like what is wrong, what is right. Everyone knows it. So, but the fun you get by doing wrong things is more. Correct, right? Prohibited things. You like it more. So, and what happens is, as I said, out of 7 days, Friday night starts the weekend. So, Friday, Saturday, Sunday. So, half of the week is weekend. So, obviously, you start consuming more and you gain more and a lot of health issues. And especially fatty liver is actually, to be very frank, from last 5 years, because for all obese patients, I do the ultrasound scan mandatory.
Oh, you do?
And very, very heavy fibro scan liver. So what happens, what I see is nowadays, the fatty liver has become very, very common. Grade 1 has become like normal to everyone. So grade 2, grade 3, they come with very heavy grades.
Alcohol and obesity is like a double whammy.
Yes.
Both can affect the liver.
Yes, fatty liver. So the grade 1 goes to grade 2, grade 2 goes to grade 3, grade 3 may land up in cirrhosis. You know that, you're a gastro guy, so you know that.
When a patient has fatty liver and they have obesity, when they progress from stage 1 to stage 4 in cirrhosis, many bariatric surgeons, when they do the surgery, they see the actual cirrhotic liver sometimes.
Yes.
But on the imaging, the ultrasound or the CAT scan will show a relatively normal liver.
Correct.
Have you seen that?
Yes, very often, because every patient we see the liver, because I operate on the stomach, which is hidden behind the left lobe of the liver. So what happens? I lift the liver and do. So that's the reason I keep them on liquid diet before surgery. I want the liver to soften down. I want some fat to go from the liver. Some weight loss will help in fattening of the liver, thinning of the liver, so I can lift the liver smoothly and operate. Because, for example, recently I operated a 198 kg guy. The liver was almost like 10 centimeter thick, the left lobe. So it has become very difficult for me to lift the liver and operate, because this patient, what they're thinking is they're walking normally and all. They think everything is good inside. He doesn't know that he has this thick liver.
Fatty liver.
Obviously. So for us, it's become very hectic for us to operate. We got a shoulder pain for the patient to lift the liver and operate. It's very difficult. So patients should come early to us than coming to 188, 198 and all this stuff. So
198 kilos.
And very often I operate 200. It's become very common.
How much does the weight of the bed handle?
So bed around 450 kgs.
450 kgs, okay.
So it can handle.
Okay. That's a good question, right?
Yeah, good question. No, I have one patient from, what maximum I operated is 250 kg. To be very frank. 250, 248 is the maximum weight. 230, 200, so many I did. 200 plus, so many we did. I have one patient from Delhi who is 338.
338 kilos?
Yes. He has, he can't
roll. He cannot roll.
Roll also difficult. Walking slightly, we can walk and all. He's in touch with me. I think soon we'll operate him. So we are kept him on liquid diet and proper pre-op evaluation we'll do. We'll shift him from Delhi to here, we'll operate. So what I feel is, this patient also, once upon a time, he was 150, 200. Slowly 250. Then what happens is he thinks that no one can operate me and I'm become so heavy, I become so high risk. Because surrounding doctors also will say you are very high risk for everything.
Can you educate the audience what is high risk?
High risk means what happens is when you are too obese, your lung function is compromised, your heart function is compromised, your liver is very heavy, you have high diabetics, you have high cholesterols, you have high blood pressure, you have heavy snoring, sleep apnea you have, then this category comes in high risk. So what happens, the more and more weight you gain, you land up in more and more metabolic issues, which will further worsen the condition. So what happens is people who are 200, 250, still there is a hope we can operate. So nothing is like we can't operate this patient. So we very often, for example, last week, one day only I did 202 patients off. I released a reel also. I'll just share with you. So what happens, 200 has become very common for them. Understand, right? they would have become 120, 130. That time they would have gone to a doctor and asked, "Sir, can I do the surgery?" So they would say, hey, no, it's okay. 130 is okay, you can do. Understand, right? So this negligence would have cost 150. Then they become 150, 160 kg. They think, oh, I may be very high risk for surgery. If something happens to me on table, kind of thing. This fear will pull them to 200. So by the time they come, it will be 200, 220, 240 kind of thing. So still we operate, a lot of patients come to us like that.
What is the ideal weight that somebody thinking about bariatric surgery should come to you?
I feel the weight is subjective according to the height, age, and everything. So what happens? Height is specific India. If your BMI, that is according to your height, you should be height in centimeters minus 100 is approximate weight. For example, you are 180 centimeters, minus 100 is 80. You should be 80. If you are 25 kgs more than your desired weight, you qualify for surgery. For example, you should be 80. If you are 105 plus, you qualify for surgery. Understand? 25 kgs more than the desired weight.
Okay, so my height is 176.
Yeah.
Minus 100 is 76 kilo.
If you become more than 100, you qualify for surgery.
I qualify for surgery.
Yeah. Roughly, I'm talking about.
Yeah,
If you consider as BMI points, it will be like 32.5 plus.
Right. No, I don't need surgery. I'm just asking.
Yeah.
So more than 100 kilos. Let's say I was 100.
Yeah.
Okay. When I come to you, you're also going to encourage lifestyle measures of losing weight first. And I will try calorie control, sleeping properly, all those things. At what point of time I would say that, hey, no, I tried everything.
See, you are saying you were also 100 once upon a time. See, I'll tell you what is happening. Whoever is more than 25 kgs, I don't operate. They qualify, I'm telling. To do a surgery, this much BMI should be there. So, for example, who walks into our patient? For example, you said 100. If you're 100, you walk into my OPD. I'll do a body mass analysis. Then I will see a BMR. And I see a fat percentage distribution. And I see a visceral fat. Visceral fat is very important.
Educate again, what is visceral fat?
Visceral fat. There are two types of fats. One is below the skin, that is called subcutaneous fat, like this, when you see outside. Visceral fat is which is attached to your intestines and liver, that is called visceral fat. This subcutaneous fat is not dangerous. It may be cosmetic value. But visceral fat will cause all the diseases. Like whatever diabetes, blood pressure you're going to get is because of those visceral fat. We measure the visceral fat. The visceral fat should be less than 10. If it is less than 7 or 8, it's very ideal. So as Indians, we see a lot of central obesity. So visceral fat will be more around 10. So if the visceral fat is 20, then it's a danger symbol. Understand? And one more CB is ultrasound scan, check your liver. If it is grade 2 or more fatty liver, then definitely it has to be addressed. Because this, in no time, it will go into grade 3. Understand? Go land up in cirrhosis. As I was telling, a lot of alcoholics also, as in India, it also causes cirrhosis, micronodular cirrhosis. Along with it, if weight gain is also combined, it will become a deadly combination. That is one thing. And so many patients who are BMR is low, whatever they do, they may not lose weight much. To be very frank, if the BMR is good, I'll still say yes, go. Go ahead and try something for yourself, like diet, exercise, whatever you want to try. Please try. For example, some people lose gain. So this is very, very common. Because our body is set into a fat set point. For example, I am 80 kgs. My fat set point is around 80. So what happens is, I lose some weight in Ramzan fasting. I may lose some 4 kgs, 5 kgs, become 76. Before Bakrid, I'm back. Bakrid is 2 months after Ramzan. So within 2 months, I'm back. I lost 4 kgs, but because my fat set point is 80. Understand, right? So people who are very obese, the fat set point is deranged.
I see.
There is no control on the fat set point. My fat set point is controlling it. For obese patient, there is no control. So that's the reason they become 100, 120, 150. It's deranged. One of the reasons for derangement is multiple weight loss attempts are also. For example, if I'm 80, if I become 100 in 2 years, for example, if I do too many attempts, that 20 kgs, if I have to gain the 20 kgs in 2 years, I'll gain 6 months only. Because I'm repeatedly doing too many attempts, which I'm not consistent. I may do for 3 months, leave it. I may do for 1 month, I leave. In this way, I'm disturbing my fat set point.
Wow. So if someone is listening to this podcast
Yeah.
and let's say that they are in the weight loss journey and they have attempted a couple of times
Yeah.
and they come to you, and based on what I understood, you check the BMR. If the BMR is low, let's say like 1000
Yeah.
or 1200, you have an idea that that patient should do even more to increase the BMR and then lose weight. It's going to be a big issue.
Yes. Herculean task for them. See, what happens is, for women, we don't have much. They don't have much muscle and bone weight. Men has more muscle and bone weight. So if the men BMR is slightly low, we can slightly tell them 100, 200 calories. We can still tell them, please do something else. For a women, it is not difficult. It's not easy, even though they are trying from themselves. So many patients who walk into my OPD, they say, sir, we don't eat much. We eat very less. Because there is a column called dietary habits. I always ask them, how much quantity you eat? Sir, I eat less. I skip meals. How they are gaining? Because the BMR is so low. And they have, along with it, they have PCOS, they have hypothyroidism, they have cortisol issues, they have sleep issues, even sleep. Sleep is very important.
Lack of sleep causes weight gain.
Yeah, obviously. So lack of sleep causes weight gain. And even stress. Stress will release a lot of catecholamines and all this corticosteroids. So what happens is that in turn will cause weight gain. So the steroid hormone, which inbuilt steroid hormone I'm talking about, will cause weight gain. So in this way, a lot of things which is lowering your metabolism.
So when we talk about this to the patients, they always are scared of surgery.
Correct.
Can you educate the audience? What is bariatric surgery?
Yeah. See, if you really see, Barros, the word, Barros means overweight. Surgery. Any surgery for overweight. If you really say overweight is a small term, obesity. Any surgery for obesity is bariatric surgery. So what happens is, nowadays we are not calling it as a bariatric surgery, we're calling it as a metabolic surgery. Because your metabolism is getting corrected. Your diabetes is getting corrected, your blood pressure is getting corrected, your cholesterol, PCOS, hypothyroidism. So many health issues are getting corrected. So that's the reason we call it as a metabolic surgery. It's good to call as a metabolic surgery than bariatric surgery, to be very frank. This is a correct word.
Metabolic surgery. And to a layman, how do you explain what do you do?
Yeah. So what happens is, what we do is we put a small holes on the tummy. Small holes, like a camera, we put a camera, laparoscopic technique basically. We go and reduce the size of the stomach, join with the intestine. So basically what happens, now before the food quantity was very high, now it becomes small, but instead of eating 3 times, you can eat 4 to 5 times, small quantity. Number 2, the hunger cravings will come down. And number 3, satiety will increase. Like for example, even if you eat less, you feel full. And number 4, the hormonal changes which will happen after surgery, which will melt fat from everywhere.
And how long does this take?
It takes around 8 to 10 months.
8 10 months. And how much weight one can lose?
So it depends on how much excess they are. So those are around 80% of excess weight. For example, I should be around 80. If I'm 140, I'm 60 kgs excess. Out of the 60, I may lose around 45.
45 kilos.
Yes. We have patients, for example, we operated a Bangladesh patient who was 240 kg. He's 101 now. He lost 140 kgs. So how much depends. Weight loss is different for different people. I want to say that. If you are more, you may lose more.
But this is not, somebody shouldn't think this as, okay, I got my weight loss surgery, I can eat whatever I want.
So, whatever we may do, you should also have some discipline in your life. For example, you should be away from the calories. You should have a habit of walking 1 hour per day. You should be bold and frank to say no to calories. Like calories means sugary items, sugary bakery items you should avoid. Cola, Pepsi you should avoid. Rest of the thing, rice and everything you can eat, non-veg and all the stuff you can eat. That's not an issue.
And people usually, sometimes they do gain the weight back after surgery, right?
Yeah.
Why does that happen?
Some people lose because what happens, post-surgery, the follow-up is very important. When I do surgery, you should always come for follow-up. Every 3 months follow-up is important because if you're doing a small mistakes, I can correct them then and there itself. So lack of follow-ups, what happens is they start eating too much of solid food which stretches your stomach. So I want them to eat soft food, chew well, and keep a habit of walking and all the stuff, and avoid solid food as much as possible. Keep it a soft food and all. If you keep a habit of eating soft food, chewing well, the chance of gaining back is very, very less.
Very less. And we had this question where people say they eat 3 meals a day, and people are saying you should eat only when they are hungry.
Yes.
Even among the medical literature, there is a split in the opinion. What do you think?
I feel people should eat 5 times a day.
5 times a day.
Small meals 5 times a day. Small frequency. So what happens? They should eat 3 meals, and they should eat one fruit meal, one vegetable meal. So 5 times a day. So small frequent meals. In that way, what will happen? The insulin spikes are not more. As I told you, when the insulin spikes happen, you accumulate fat. Because the insulin is pro-lipogenic, because it will help you in accumulating fat. So, madam, the spikes are less, so the weight gain is less.
Yeah.
Because you eat this much. For example, you eat this much. You go to party and all. You eat this much. The insulin spike is too much. That will in turn will make you gain more weight. Because it can't metabolize whatever food you eat.
So, I'm involved in some intermittent fasting research. What we have figured out was insulin spikes is a problem for people with insulin resistance.
Correct.
So, let's say you're normal and healthy, you really don't have to worry too much about insulin spikes because that is what the body is supposed to do. In the intermittent fasting research, what they have done is if you give rest to the insulin for a longer period of time,
Yes.
so either you eat small and frequently and decrease the calories, or you cut down to like 2 meals a day and then give rest to insulin in between. If you want to have snacks, have it along with lunch.
Understand.
And then between the lunch and dinner, there should be at least 4 to 5 hours of an interval, and the dinner and the next meal should be at least 12 hours.
Correct.
So, as you said, some discipline needs to be there even after the surgery.
Correct.
And why do people still feel hungry after eating like heavily?
Because the thing is, their satiety is not there. For example, I feel full. I don't feel full. Even after eating one biryani, one and a half biryani, I'm not feeling full. This is something which is really worried about. So the cravings and midnight cravings. You watch some movie in the Netflix, you on the movie, you keep munching, we don't know how much calories you eat. So what happens? They don't know how much the satiety, where to stop is a big problem. You may see in many of the patients. Even I feel when I do bariatric surgery, I see a lot of people will have big stomachs. Who's 180 kg, 120, 200 kg. They have big stomachs. They can accommodate more. Understand, right? Because stomach is the bag where you can fill it with food. The digestion doesn't happen. It goes in the intestine, digestion starts. So what happens? You can fill an amount of people. Because the stomach is big, definitely it distance more, and so this kind of satiety is the big issue which people are facing nowadays.
So you think the stomach...
Post-bariatric surgery, that will be addressed.
Of course, because you're cutting the stomach.
No, about that too, one more thing is the food doesn't go into, the ghrelin comes down significantly post-bariatric surgery, which doesn't happen before surgery. Ghrelin is something, hunger hormone. It comes down significantly. You don't feel much hunger. And even satiety, the GLP-1 releases post-surgery. The GLP-1 will cause satiety, early satiety. You eat this much, you're happy. Because people who are 200, definitely they wouldn't have just become 200 by 2 meals, 3 meals. They would have eating 7 times a day, 8 times a day. How do you control post-surgery? The craving should come down, right? So that's the thing.
So I have seen you dance with your patients after the surgery.
Yeah.
Right? Is there a common thing for every patient?
Yeah, not for everyone. But most of the people who are enthusiastic, who wants to get, who knows some moves, then definitely we...
And this is after the surgery.
After the surgery. Then next, see why you do dance post surgery is people who are heavy, they're already in fear. Something will happen to me. So what happens post surgery? If a person is dancing, it means he's very active. Understand, right? He's very active to go home. So what happens is this dance will fill some happiness and it will remove your fear. I'm fine. That's the reason I'm able to dance post surgery. It is like a signal to everyone who is obese. Like you can early mobilize. You can do everything post surgery. There is nothing that you can't do. Whatever you're doing before, you can do it more efficiently. That's what I want to say. That it's a message to them.
So let's talk about patients with hypothyroidism. Thyroid patients. Why is it difficult for them to lose weight?
The hypothyroidism makes your whole system slow. So the TSH, if you really see the blood levels, the TSHs should be around 5.
That is the thyroid stimulating
Stimulating hormone. If the TSH is 10, 15, this is hypothyroidism.
Can you just educate the audience on the difference as well?
Yeah.
If it is high, it means you have low
Yeah.
thyroid.
So what happens is the TSH level indicates your hypothyroidism or hypothyroidism. It is reverse. If it is hyperthyroidism, the TSH will be low. If it is hypothyroidism, TSH is high. This TSH, what happens? Thyroid stimulating hormone, that will basically what unbinded thyroid hormone is low. So what happens? It makes the whole system slow. Even the metabolism goes slow. Okay, you're sleep deprived, you're depressed, your reflexes become slow, you react slow. For example, someone calls you, react slowly. This is the similar way. The hypothyroidism is like this. It will make the whole system slow, including your metabolism. So in hypothyroidism, people may not be knowing their hypothyroidism. They keep put on weight. Suddenly they go to the physician checks your thyroid, then they will say you have hypothyroidism. So this is the reason. So what happens is blood better if you're getting obese, it's better to get your thyroid get checked. So at least you know that thyroid may not be the reason for it.
Tell me a patient's experience with thyroid and weight loss and bariatric surgery that you have seen.
So many. Most of the young girls who come to us, they always come with a deadly combination of PCOD, the PCOS, cyst and the ovary, and hypothyroidism. So both this deadly combination will make the system very, very slow.
Young is what, like 20, 25?
Yeah, very commonly. So even 13-year-old girl will come, 16-year, 19-year, 25, 30, marriage age. Some girls will come, marriage is an issue.
So they'll come to you because of the weight gain and marriage is an issue.
One more is the patient is not menstruating for years together. Because of heavy weight, they're not menstruating for 6 months, 7 months. They go to the gynecologist, they get some temporary progesterone tablet, get the temporary menses kind of thing, spotting and all this stuff. Again, they are not menstruating.
Can you educate the audience again? I'm so sorry to interrupt. I'm just trying to get into the layman terms.
Correct.
So when there is lack of menstruation for
irregular menses,
irregular periods,
either heavy menses or no menses. Many of the times there is no menses. They are not menstruating for 3 months, 6 months in a stretch. Understand it? Again they menstruate. Again they not menstruate for a few months. That is called irregular cycles, or menstrual cycles. And this kind of patients, they keep put on a lot of weight. And the hypothyroid hormone also slows down the system. So these girls, I can say, even though they are not eating, they put on a lot of weight. The BMR goes low. So that's how they put on a lot of weight in hypothyroidism and PCOS.
I've seen many patients, in my, that lifestyle medicine clinic called New Me, where people come with hypothyroidism. They do everything right. They eat properly, 800 to 900 calories, they work out. I feel very bad for them because they need to do 2 times the effort than the normal person.
See, everyone should know it is not only the person who has to be blamed. Sometimes it is internal system which has to be blamed. See, if your hormones are not correct, even if you're following the strict disciplined diet may not work. The parents should be thinking this girl doesn't listen anything, this girl doesn't follow. Nothing like that. Some things are not in their control, which is making them put on weight. So not every time the person has to be blamed. There's so many things. For example, one person came, his parents, his mother, father, paternal, maternal, everyone is obese. So what happens is this guy is putting on weight even though he's strictly following. Because genetics is very strong. It is not the boy who has to be blamed. It's genetics which has to be blamed.
So genetics just play a role?
Yeah, very strong. Very strong.
How many percentage you will say?
I don't know, but many of the patients, what happens is I see their parents, one of the parents is obese. Or the grandparents is obese. Their aunts are obese. Obesity would have come in their family.
So they
if both the parents are obese, there's very, very high chance this boy is going to be obese. Or girl.
Is it because of the environment or is it because of the genes?
Genes play a very major role. Even I said, no, the genetics plays a role in getting down the BMR down.
In your patient, when they come for bariatric surgery, their parents are obese most of the times?
Yes. See, that is the reason my clinic is designed in that way. I learned something from Taiwan. So where my clinic has sofas. They don't have chairs.
Sofa, okay.
So many sofas are there. Why I made sofas is there is a logical thinking behind it. See, when a person is obese, most of the family people are obese. So no one can fit into chairs. So the sofas are made to make them sit comfortably. Understand, right? For example, a surgical discussion. For example, for a medication, you got a fever, you can go alone to a physician, get it, write it down. If you want to take a surgical decision, the whole family has to accompany you.
Correct.
Everyone's green signal should be there to go to surgery. I see, for example, 3 members in the family, most of them are obese. Parents are obese. May not to the extent that baby is obese, but still, they're obese. So in that way, most of them are obese. So that's the reason the sofas are made for them. And the room should be bigger one because, and I show them in the projector. So what happens is, it's easy for them to
see.
because when you see it, you will understand it. If I draw anything, it will not be visible.
And in these patients, the hypothyroid, PCOS patients, after bariatric surgery, they get better?
Yeah, PCOD does amazing. What happens is the menses gets into regular shape within 6 months. The PCOS physical, what happens is there is a physiological change and an anatomical change. First physiological change happens because the main treatment for PCOS is weight loss. You go to any doctor, the treatment is PCOS is weight loss. So within 6 months the menses get better. What happened? They used to get a lot of hair everywhere. That will reduce, and the hoarseness of voice comes down. And wherever you felt like it's difficult to lose weight, they would have lost from the hips. Very difficult area to lose weight. They would have lost weight from there.
IVF outcomes?
Yes, very good. Post surgery, what happens is IVF. There's people who are not conceived with IVF also get conceived. If there is no anatomical problem in the uterus, if PCOD is the only problem, they get conceived.
So PCOS patients should consider surgical intervention.
They can consider if they're morbidly obese. If nothing is working for them, then definitely they should consider. But only thing is, they have to conceive. They have to give a gap of 1 year at least between surgery and conceiving.
I see. And you have successful patient outcomes.
Yes, lot of n number of patients.
How many patients do you see in a day? And new patients?
New patients, around 4 to 5 obese patients I see.
4 to 5.
Yeah.
Out of this, is it male or female majority?
I should say 60-40. 60 is female, 40 is male.
60 is female. Why is it very common in women? You think it's because of hormonal imbalance?
I think hormonal imbalance is one of the things. And in women, what happens is, I don't know what is the thing, the cravings are more than men. I always see that. Women cravings are more than men. For example, for the chocolate, for the bakery item, the men crave less than women. That I feel like that. And PCOD, hypothyroidism is one of the reasons. And what happens is,
I feel like
the fat accumulation is very easy for them. The reason is, they have less muscle. They have a lot of space to accumulate fat. The muscle, anti-rectus abdominal muscle, is less in women compared to men. That's the reason the stretching happens in pregnancy and all. So what happens is, a lot of people accumulate fat.
And I also feel like the sleep may be less.
Is it?
In women.
Oh, is that okay?
In general, because of, I feel like,
maybe
they are the main person taking care of everybody in the family.
Correct.
And as you said, lack of sleep.
Yeah.
There was a study when they said that if you sleep only 4 to 5 hours, there is a 22% increased risk of obesity.
Correct. I agree with it. I completely agree with it. Sleep is the only time your body repairs. If you're not giving the time to repair, definitely it's going to be unrepaired. That will carry forward.
Okay. Of course, you will get the history of the sleep as well in your patients, right? Is it a common thing to have like less sleep in your patients?
See, I see many of the times people are not sleeping with obesity because there is a lot of fat accumulated in the airway tract, which is not allowing the 100% oxygen to go there. So in that way, they're not sleeping. So what happens is, they don't sleep flat. They sleep standing, sitting, not standing, sitting.
They sleep
sitting, 45-degree elevation. Because if they sleep flat, the tongue falls back. That will further obstruct the air to go inside. So I see this very commonly. And the sleep apnea, they snore a lot. And they feel like someone is choking them. And there's many patients are on BiPAP machine for that. BiPAP or CPAP to get sleep. So.
And those patients are meet the criteria for surgery.
Yes.
And it do get
the primary patient who should do surgery immediately. Because we have seen, I don't want to name the music directors and all. 1 or 2 music directors in India have died because of sleep apnea. They lost their life because of obstructive sleep apnea.
Sleep apnea can cause death.
Yes. See, what is sleep apnea? So what happens is the oxygen is going and coming, usually for me and you. So what happens is, for some patients who are obese, there is temporary stoppage of breathing. That is called apnea. There is something called hypopnea. So the less, understand, right? So what happens is they're breathing, they're not breathing. They're breathing, they're less breathing. That is hypopnea. So in that way, there is apnea. So some part of the time in the sleep, they're not breathing.
When you say they're not breathing, the oxygen is not going inside the lungs at all.
Yes.
Because the tongue is big.
Too much blockade.
So
That's the reason they use a machine called BiPAP, where the machine pushes the air into forcibly inside, where it can't go through normal area. The machine pushes it inside. So they're breathing because of that. If they put that machine, they'll sleep. And many of the times what happens, I don't know the biological changes. We have a habit before. What happens is in the ancient times, they sleep by 7 o'clock. As soon as the dark happens, they sleep. Nowadays, what happens, they don't sleep till was 3 a.m. in the morning, 4 a.m. in the morning. When the biological changes which they are making, it's very hard for them to fall asleep. So sleep pattern is completely changed. So the time where you have to sleep, you are not sleeping. Where you should not be sleeping, you are sleeping. So in that way, it all causes, say, hidden stress in your body. There is some subconscious stress this will cause in your body, and definitely the stress is going to initiate the cortical secretion, and definitely you're going to put on more weight, and the cravings and everything will increase.
So we did a study where we said, let's calculate the BMR
Yeah,
in patients who were sleeping more than 7 hours
yeah,
and sleeping less than 7 hours. We did know that less than 7 hours will have low BMR, but we didn't realize that the magnitude was so much
correct,
that the BMR was around 800 to 1000 only,
correct,
which means that they can only handle only 1000 calories per day.
correct,
That's it. Anything more than that, they put on weight easily.
correct.
So I always, and then in that majority were women.
But some people, I feel, the sleep time is also varies a lot. Some for some 5 hours is enough. For some 8 hours is enough. Some people who are 6 hours, they'll be happy. Understand? So it depends. But if you really say
Majority,
6 to 8,
actually it is 8 to 9.
8 to 8. For me, I'm 8 hours guy.
Right, was good, yeah?
Yeah.
8 to 9, because I know I had a sleep specialist come on board as well. And then he said that yes, there are few people who sleeps only for 3 hours and they're doing great. Right? It is very, very rare. If you feel like you are doing great in 3 to 4 hours, you really need to see whether you are active throughout the day.
Correct.
There should not be any mid-afternoon dip.
Correct.
It should be energetic throughout the day. That doesn't happen.
For example, I was reading an interview of Shah Rukh Khan. He gets only 5 hours sleep. And he's super active whole day. So for him, it is enough. For us, 8 hours is mandatory.
Yes.
Anything less than 8 hours definitely is not going to work.
Yes. No, of course. One other question I want to ask. You said that you're cutting the stomach and you're joining the intestine. So the size of the stomach is being reduced.
Yes.
After surgery, will that stretch back?
No. See, what happens is, if you maintain it well, if you maintain small quantity, avoid solid foods. Avoid foods which can stretch your stomach, like very hard foods you can avoid. And number 2, chewing well. And keep a spacing. So what happens is, too much of food not at one go at one time.
Because your stomach cannot handle.
And cola, Pepsi, effervescent drinks. All these effervescent drinks we should avoid.
The bubbly drinks.
Bubbly drinks we should avoid. So if you avoid this, and definitely there should be some maintenance post-surgery also.
I want to ask you, you are changing lives, to be honest. I think the surgery that you do is not an easy one. And I'm glad that you have done so many. How many surgeries you might have done?
I don't know. I didn't keep a count of it, but doing this from last 13 years.
Last 13 years. And
in Bangalore from last 10 years.
Before that?
I was in Bombay, I was in Gujarat,
so you've been...
Belgium. So many places I was trained. So.
I see. So let's say that 13 years, minimum 1,000 surgeries you must have done. More than that.
Quite more than that.
So in these surgeries, the outcome, which is the one most inspiring transformation that keeps you going?
Yeah. One girl, I remember still. One girl who is 16-year-old girl. She came and met me. She was 130 kgs.
In 16?
16 years. And she has not menstruated from 2 years.
Wow.
14 years she attended menarche. Till 6 months or something.
She reached puberty at 14.
40, 13 and a half, I think. After that, she menstruated for a few months. Then she didn't menstruate at all. And she was like PCOD. She went to go to the doctor. They give the progesterone pills. They temporarily menstruate. So this was the thing which is happening. Keep on putting on weight, goes to some mild PCOS to high, very severe PCOS and all this stuff. So the 130 kgs is huge for anyone.
Yeah.
So she was panting for small walks. So that's the reason they felt it's alarming. The parents bought her and all that. I explained a bariatric surgeon and all. Okay, somehow for the parents in their minds, marriage is the only final destination, according to them. Health and all is okay, kind of thing. So somehow she got married.
Young.
16 years, 17 years, whatever. She got married and all. After some time, the mother calls me and tells her, "शादी हो गई, अभी क्या हुआ, अभी कुछ नहीं, सब अच्छा हो गया."
Oh my God.
So बाद में, after 1 year after this one, she's after 19, I think, after 1 year, 1.5 years, they tried. She didn't conceive. Obviously, they're so heavy you can't conceive. Some amount of fat is required to conceive. Over fat is you can't conceive.
Because of the hormone.
So what happens is now the husband bought her. Or do surgery. That time when she came, she was 138. She gained 8 kgs more. So in between, she tried some medication, which she got temporary relief. Like she lost around 10 kgs, and she was telling, "I found the technique for it. I may lose like this only and come back to 70." You know. She lost 10 kgs, gained 15 kgs. That kind of thing happened. So that time I did, and they went for conceiving to IVF also. IVF people told, "We can't do anything for you. 138 kg, we can't do anything. It will not work. Please lose weight." They also said no. So they came, finally they have to come to me. I told them, "You have to come to me, Gago." So after 2 years, they said, "Yes, doctor, you are right. You said you have to come to me. We have come to you. Final destination is you only." So we did surgery. Actually, this girl conceived within 9 to 10 months after surgery.
Naturally.
Yeah, she lost around 40-45 kgs.
Wow.
So got less than 100. Conceived naturally.
Wow.
Which was not possible before. So what happens is now I think 5 years post surgery now. She has 2 babies. And now she's 70. 138 to 70. So 68 kg she has lost.
Wow.
Half of it. So she has become inspiration for many people who are having PCOS, who are having IVF, obesity, unable to conceive. She has become an inspiration. Many patients like this. I just told one story.
And PCOS gets reversed.
Yes. PCOS, the main treatment is weight loss. And hypothyroidism also, to one extent, it gets better. Or at least if it doesn't get better, the dose will come down. The severity will come down. If you see subclinical hypothyroidism, yes, it gets better.
Let's say you're on 50 micrograms, you can go down to 12.5.
12.5.
Or even
sometimes, yes. Sometimes we can stop also.
Stop as well.
We can't warranty the hormone thing, thyroid.
Correct.
But PCOS, yes. Many of the times it gets better.
You were saying. So a person listening to this podcast, okay, so they are very confused. Okay, so I am saying fasting, you are saying surgery, and somebody is saying that Mounjaro, Ozempic. What is the role of these medications? Ozempic, Mounjaro, Wegovy, all these new medications are claiming
I'll tell
to
you
be
one
weight
thing.
loss.
Not one treatment is there for everyone. It depends on your BMI, how much fat percentage and all. So if you really see, my surgery works with the BMI is 32.5 plus. There are a lot of people who are between 25 to 32 BMI. What are the options for them? They can really try diet, gym, exercise, Mounjaro, whatever they want to try. But what happens is, whatever medication, whatever the other things, Wegovy, Ozempic, whatever, you may lose till you take. Once you stop, you are back again. It is not a permanent way, it's a temporary way. I can say it's an intermediate way. So what happens, but some side effects are there with this medications also. You have to take that in count. The pancreatitis, blindness, nausea, vomiting, so gastroparesis, and all the side effects are there. If you are okay with it, you can take the medication. But it is not for the people who are morbidly obese. People get confused that nowadays what happens outside, physicians, endocrinologists are giving medication even for morbidly obese.
Tell me
That's wrong with it.
definition of morbid obesity.
Morbid obesity is almost 35 BMI with any health issues. Or if it is no health issues also, if 35 plus BMI is morbid obesity, according to Indian population.
Indian population, exactly.
If you go to US population, it's 40.
40, yeah.
So the criteria varies.
So we'll revise it for our audience. So body mass index more than 40 is an indicator for surgery.
Yes.
In the US. But in India, because
35 plus.
35 plus.
because our scale is different. Because we have thin hands and legs. We have central obesity. We have too much of visceral fat compared to the US population. So that's the reason 35 plus BMI, yes, morbidly obese you are.
So in that category, you don't recommend Ozempic?
Yeah, because even Ozempic and all is for the people who are overweight category, not the 35 plus morbid obesity. People who are overweight, intermediate between the morbid obesity and normal weight. Those patients, they can try. They can try. If they're not working, we are always there in backup. And it will work for the people whose BMR is good again. If a BMR is low, it will not work much. And the weight loss is subjective. For example, yesterday I consulted a patient who was on Mounjaro for 3 months. They lost, she was around 116. She stopped at 100. 16 kgs she lost. Now
116. She was 116, she came down to 100.
Now she stopped medication for 2 weeks. She slowly came to 104. If she stop again for 2 more weeks, she'll come back again to back. So she said, sir, I've spent around a lot of money. A lack of money. So I didn't see that much result. So those kind of patients say, because she's morbidly obese. First of all, she shouldn't have tried itself. Understand, right? So, but to be very frank, it's in India. Nobody seriously follows the guidelines. They just do randomly whatever they want.
Many people are taking off-label as
Off-label also, they will taking off-label also. If someone they know doctor also, they'll take that and use it.
I got a message on WhatsApp, buy one, get one free.
That offers are also there.
But I know the price range. It's 4,000 rupees
per injection.
Per injection, once a week. So 15,000.
No, that is for 2.5 milligrams. The dose are high, na? 7.5, so many. So it is not only one Mounjaro, it is Wegovy is there.
Correct.
And so Ozempic, so many others. So what happens is, this medication is for the people, I strongly feel, this medication is for the people who are obese with diabetes. Understand, right? It is not for the people who are just like that. So I feel it should be used judiciously, cautiously. It can't be used like randomly, whatever you want. So what happens is, the side effects are also not so easy to manage. So in that way, I think, and that too, then weight loss with medicines and surgery is completely different. With the surgery, you may lose 80% of your excess weight. In medicine, you may lose only 10% of your excess weight. That's very less. For example, you're 150 kg. You lose around 12 kgs, 13 kgs. What difference it makes? You're still 135. Understand, right?
But what if the patient adopts lifestyle?
Post-surgery, yes, they'll maintain at least that. They may not go back because the BMR is low. They may not go back much. My surgery will change their life. He's 150, he may come back to 80s, 90.
Quality of life will increase, you say?
Definitely. See, life is like a journey. Understand? The lesser the luggage, the longer the journey. I'm reducing the luggage, so longer journey.
There is an increased risk of anxiety, depression among these patients with obesity. Is this because of shame and guilt that is being translated to them?
See, what happens is, when you're obese, wherever the joke starts, it ends on you. Understand, right? So, obesity is something which they can joke about you. They can make fun about you. So, if 10 people are there, all the jokes finish and the final joke will be on you only. See how he's looking, how he's making, how he's snoring. So, this is the things which will not allow them to socially mix. The social, the social battery will be less for these people. They don't want to interact with people. They want to stay at home. They don't want to step out of the house. For example, if I want to go and buy some stationery shop, I will be ashamed to walk there because people will watch me and make comment on it. Understand, right? So this is a stigma which they carry a lot, and many of the times they may come us to in the late stage with heavy weights because of stigma. They can't tell this to anyone. Even parents will tell, hey, too much he'll eat. Parents also start taunting. So the taunting starts from the house itself. So everywhere it's the same thing. So what happens is, sometimes, as I said it's not their mistake. It is the genetics. It is the hormones to be blamed. Understand, right? So definitely they should come to a doctor, obesity doctor, and they will do the body mass analysis. Then they will decide what kind of treatment suits him. Correct, right? So BMI is the main thing which they should do first. Instead of going anywhere first, do BMI, then go to a doctor. If you come to our clinic, we have BMI machines wherever, in clinic, hospital, and also they will do the BMI and definitely will Guide them accordingly.
They'll give you the body fat percentage.
Yes.
They'll give you your basal
Yeah,
metabolic
yeah.
rate.
Yes, yes.
And then, as you said, there's no one size fits all.
Correct.
You'll have to individualize.
Yes, yes.
Wow. So we have some rapid fire questions.
Yes, yes, please.
One food you wish everyone would stop eating.
Sweets.
One underrated food for fat loss.
Blueberry.
Cardio or strength training.
Cardio.
Morning walk or evening walk.
Both are same.
Biggest diet myth you hate.
Apple cider vinegar will cause weight loss.
A habit that changed your own health.
Early sleep.
Sleeping early. Is obesity a disease?
Yes.
Most common mistake people make during losing weight.
They don't tone the muscles while losing weight.
Exercise.
Yes.
Weight loss in one sentence.
New life.
White rice.
Weight gain.
Sweet potatoes.
Weight loss.
Paneer.
Weight gain.
Chicken breast.
Weight loss.
Ghee.
Weight gain.
Banana.
Weight gain.
Oats.
Weight loss.
Ragi porridge.
Weight loss.
Nuts.
Weight loss.
Fruit juice.
Weight gain.
Curd.
Weight gain.
Eggs.
Weight loss. Sorry, weight loss.
Curd.
Weight loss.
Eggs.
Weight loss.
Milkshake.
Weight gain.
Avocado.
Weight loss.
Peanut butter.
Weight loss.
Sweet corn.
Weight gain.
Dal.
Weight gain.
Boiled potatoes.
Weight gain.
Sprouts.
Weight loss.
Fruit smoothie.
Weight loss.
Thank you so much for a detailed conversation. If there is a last thing that if somebody listening to this podcast is really hopeless that they are not able to lose weight and they've gone through the journey multiple times, what is the one last thing that you would tell to the patient?
So I always think, don't get scared with anything, whatever you see on internet. So what happens is you meet an expert. There, according to your weight and height, they do the body mass analysis. Then, accordingly, we can specify which treatment suits for you. So no one shirt fits for everyone. So like this, no one thing works for everyone. So it is customized for everyone. So do a body mass analysis, then choose your treatment appropriately.
Super. Thank you again. Thank you so much for your time, sir.
Thank you, Dr. Paul.
Thank you. Thank you.